Hi guys, it's been a long while. I did any video in my medical school series. You guys know that for the past 2 years I have basically been an intern because of the gap year that I took in between, and for the first time today I had an intern join my team. So I'm feeling very motivated to share my experience during my intern year and to give some tips on the best way to survive first year of your internship or first year of residency. And if you're interested in seeing more of these med school videos, make sure to subscribe to our channel if you're not already subscribed. So the tips that I'm going to be sharing with you in this video is largely based on my experience. Very subjective. Clinical practice might be different in whatever country that you go to, but I think this applies whether or not you're in medicine. It's basic principles that help you survive in a workplace. The first tip that I have is to go in, meet your team and introduce yourself. I think the best way to ease your transition into learning on the job is to go the week before when you don't have that high level of responsibility. You're not getting paid. It's not your official start date. It's basically you going, introducing yourself and giving the impression that you're very excited to start on this team. They would really appreciate that. They would value that. You'd make a good first impression and they would really believe that you're happy to join the team and people are going to help you. So that will be my number one advice. That's what I did and I think that really helped me, especially getting used to the computer systems, ordering bloods for patients, learning how to cannulate, the basic practical procedures that would get you on the ball once you start. The second tip that I have is to be nice to people. You know, as basic or as logic as this sounds, you will be surprised that people would go in and not even care about making the effort to be nice to people. You do not understand how much easier your life will be as an intern if you are nice to everybody. The portering staff, the nursing staff, ward clerk, your fellow interns, the people on your team, saying hello, making an effort to know people's names really gives that personal approach. I go in every morning and literally from the door, I'm like, morning Louise, morning Teresa, good morning Helen, morning Carol. I know everybody's names because I have made the effort to learn people's names, and it gives people the impression that you respect them and you value them as human beings, and I think they're more inclined to help you. People are more inclined to give you tips and advice and to make your life easier. This will help you a lot on those bleak nights when you're on 24-hour shifts, 16-hour shifts, and you're tired, feeling exhausted. People are more likely to help you with your tasks rather than bleeping you all the time. So I can't really stress enough how important it is to be nice. I'm going to make a separate video on surviving call, but I'll save that for a different video. But for now, be nice. The next tip that I have is to carry a clipboard. Now, this might sound very stupid, but this right here, this clipboard was a lifesaver during my intern year. Honestly, you cannot practically carry around an Oxford handbook. I know that they would advise you to have that when you're confused about doses or how to manage a patient, but the advice that I would give, which I did, go on your computer and literally write out the basic medications, the doses, the immediate management for common emergency. Print that out and stick it onto this clipboard. Normally, the way we work on the wards here in Ireland, every morning you print out a patient list, and when you go on the ward round, you can make notes on what needs to be done, what medications need to be updated, and any change basically with that patient. You will make a note in the printout. What better way to write it than on the clipboard? I can't even tell you what better way to write it. This is a lifesaver. If you have any documents that you need immediate access to, stick it on here. You literally have everything at hand. The other tip that I have is to accept help wherever you can. This, I will tell you, is one of the big mistakes that I made going in. It's something that I've learned along the journey of this intern year and the journey of motherhood. If you watch my lifestyle videos, I stress a lot about accepting help because that just keeps your mental health in check. But as an intern, you could potentially make the mistake of going in with this very competitive mindset that we all had in medical school, and you are about to get yourself burnt out. If you're on call, work in teams if you can, work as a pair, accept help from people who want to help you. When you're bleeped to do a job, you can ask whoever bleeps you if that's something they can help you with. Maybe you're in a different part of the hospital and it's going to take you ages to go. Just ask, oh, do you think this is something that you can help me with? I cannot stress how important this is, and this was a big mistake that I made. I went in there thinking, oh, I'm going to prove to myself, mostly, not even to anyone else, that I'm very capable of doing everything that I'm required to do. But you don't get a gold medal for that, honey. No, you don't. You get burnt out. That's what you get. So accept help when it comes. And even when it doesn't come, seek help. The last advice that I have for you today is to make a good impression with your team. Being nice is different from making a good impression. And the way to make a good impression on your team is to show up early. Listen, as an intern, okay, you are the bottom of the food chain when it comes to medicine. So you have to be respectful of everyone else that has been there before you. There are things that are required of you, and this varies with hospitals. But personally, in the hospital that I work in, I was expected to prepare all of the patient's charts for the ward round. I was expected to book all the bloods, review the bloods, book the scans, discuss scans, do the cannulas, the nasogastric tubes, the catheters. Find out what's expected of you in your hospital and make sure that you're literally on the ball. Like when your team shows up the next morning, you should be the one telling them, I found out that patient A was hyperkalemic and this is the treatment that I've done. And if you're not sure of any medical management of a patient, guys, ask for senior advice. Listen, you're better off being known as that intern that doesn't know much and always asks for advice, rather than the intern that prescribes a wrong medication, because there are medical legal issues for that. Making a good impression on your team goes beyond the hospital. Occasionally, social events that the team members organize. And for me personally, the first half of my intern year, I was pregnant. I was living away from David. I had zero interest in going to any social events, and I just found that my experience was much different. Like, you go into work, and when everyone's talking about the dinner that they had or the drinks that they had or where they went to, you more or less have nothing to contribute. So you're that team member who just shows up to work and then goes home. But then I realized that my team dynamics changed in the second half of my intern year. I'd already had the baby. I was living together with David, and David was very happy to look after Kian when I had to go for like a team dinner. It just made you that puzzle that fit perfectly in the team, because after the weekend, like, you come back on the Monday and you're talking about the banter that you had over the weekend, and everyone just flows and gets along. And I think that's also making a good impression, both socially and professionally. Be respectful to people. Remember that these are the people that are gonna give you your references. So I know that in North America, the system of training is a bit different, in the sense that you start your residency in the specialty that you want, and then you run through until you become an attending or a consultant. But in Europe, you do your 1 year intern year where you rotate through different specialties. But then towards the end of your intern year, you apply to whatever specialty you think you want to do for the rest of your career. And you have to realize that these senior doctors, the consultants, the regis, are the ones that are going to give you references. So making a good impression is a no-brainer. Like, you need to be commendable, you need to be competent, you need to be nice, you need to be on the ball. With that said, I'm going to wish everyone who's just started, or who's starting on Monday, their new jobs as an intern. I'm going to wish you all the luck you can get. It's terrifying in the beginning, it's nerve-wracking, it's confusing, but literally in a week or two you will fit perfectly, everything will be fine, and you learn on the job. You find that you're more confident as the months go along. So I'm wishing you all the best. Well done for getting a job, well done for working as a doctor. I do have loads more advice, but I'm gonna save that for another video. Thanks so much for watching, and don't forget to subscribe if you're not already subscribed, and I will see you in the next video. Bye guys.